A 50-year-old woman was brought into the emergency department because she was found wandering in a nearby park, just screaming and falling. She was bleeding. She's disoriented, combative, and she is shaking severely. Her clothing is dirty and she has a stale body odor and urine. Based on the scenario and the patient's actions and appearance, I would say she is suffering from alcohol withdrawals. People that abuse alcohol become completely dependent on that substance. Most likely, this woman hasn't had anything to drink recently because she kept shouting out she needs a bottle. She is now experiencing the symptoms, which are being disoriented, combative, shakiness, trembling, and incontinence. The American Addiction Centers share some short-term health risks that alcohol withdrawals can cause. Basically, what this woman is experiencing can be broken down into 3 stages. The first stage includes anxiety, insomnia, nausea, and abdominal pain. These symptoms will start occurring after the 8 hours of her last drink. Stage 2 causes high blood pressure, high body temperatures, unusual heart rates, confusion, and they occur within the 24 to 72 hour mark after her last drink. The third stage includes hallucinations, fevers, seizures, agitation, and they occur after 2 to 4 days after the last drink. The symptoms usually decrease within 5 to 7 days of detoxification. Alcohol.org lists some long-term health risks that can be serious and can vary depending on the person. A person can experience diminished gray and white matter in the brain, memory loss, loss of attention, trouble learning. They can have alcohol hepatitis, liver fibrosis, fatty liver, or they can acquire cancer. They can also have high blood pressure, cardiomyopathy, strokes, and irregular heartbeats. The reason why this patient is experiencing extreme shakiness is because when a person drinks, the alcohol affects their brain by suppressing their central nervous system. And since she has stopped, her nervous system is experiencing extreme hyperactivity. All that hyperactivity and being shown in her nervous system is showing through the shakiness in her hands. Confusion and combativeness is being caused by her alcohol intoxication levels, perhaps. We don't really know how high her intoxication levels are, but people that usually drink are aggressive by being surrounded or attacked by others, and they lose all self-control. They're not thinking straight. The assessments that I would do on this patient would be a toxicology level. I would check her intoxication levels and to see if she has taken any other drugs or substances. I would check her cognitive level to see if she's able to make any medical decisions for herself. I would do a physical exam to see if she is hurt from any of the falls. And I will also try and get her a psychiatric consult just to help see if she has any underlying problem causing the alcohol abuse. Mental illnesses are managed by medication and therapeutic methods. People that suffer from a mental illness can be seen by psychiatrists that can help keep the disorder under control. They can also go to group therapies or a support group so they won't feel so alone. And they will need to take medication, and the medications can vary based on the disorder, but it will help them keep that disorder under control. Some insurances offer coverage for treatment, and there's also free resources for people that can't afford health insurance. The government has programs that help people with mental disorders get help and provides resources for them to be able to function in their daily lives.